Okay, so today let's talk a little bit about an adjunct that you can add on to your weight loss injections, or you could even use this on its own solo. If you're new to me or I'm new to you, I'm Michelle. I'm a family nurse practitioner specializing in weight loss and balancing hormones. So something that I'm going to start offering to my patients that are on semaglutide or tirzepatide for weight management is adding on a low dose naltrexone. Often it's just abbreviated LDN. And basically it's a less expensive option for sure. My package is going to be $99 a month, so you'd have to shop around and see, but it's definitely a less expensive option than the injections. My hope is that I always try to keep my patients on the smallest dose of semaglutide or tirzepatide that simply reduces their appetite. No way, you don't want to just completely wipe out their appetite. There's a lot of health concerns and issues that can come if you lose your weight too rapidly. So my goal is always to aim for a slow, steady weight loss. Also gives patients times to incorporate new habits, make those really stick so that they can maintain their weight loss. Half the battle's losing it, the other half for sure is keeping it off. So low dose naltrexone is a medication that's primarily been used for patients that have opioid addictions, and like many medications, they start using them for one thing and then they see that it has some effects that you could use it for something else. Same thing for semaglutide and tirzepatide. Originally they were made for diabetes, and they just basically kept seeing a side effect of weight loss. So with the naltrexone, what they notice is what happens is it boost your body's natural endorphins, so that's always a good thing. Those are the feel-good chemicals. And then it also helps by reducing inflammation. And most patients that have extra weight or are obese have some chronic inflammation, so that's part of the process that causes it to be difficult for them to lose weight. So because the naltrexone helps reduce inflammation, it also inhibits appetite for a lot of people, reduces cravings and lowers their appetite. It can be a good add-on to those injections, or like I say, you could use it by itself. I don't think people are going to see the amount of weight loss. Like if you need to lose 100 pounds, I doubt this alone would be good for you, but I do think, if you're someone that just needs, you got 10 more pounds to go and it just won't budge, or a smaller amount, I think this would be a good place for you to start. Now, because it's anti-inflammatory, they're using it for a lot of other conditions as well. Autoimmune diseases, and these are all based basically because of the inflammation. Chronic pain, fibromyalgia, PCOS, irritable bowel syndrome, anxiety and depression. It does boost your endorphins. So oftentimes it can give people a little perk of energy as well. So who doesn't want more energy? So the main way for weight loss that it works is, like I said, it reduces the inflammation. It does help regulate appetite, especially with the cravings. It also improves sensitivity to insulin. Insulin, this is a major root cause for people that have issues with losing weight. Like no matter what you do, it just won't budge. Insulin, as we're gaining weight, is typically creeping up. There's only 16% of Americans who have a normal insulin level. The rest of us are high. And that is a hormone that tells your body to store fat. So anytime you eat and your insulin levels are high, straight to storage, straight to fat, do not pass go. So you really have to lower your insulin, make yourself become more sensitive to insulin, which will shut that down and let your body access your fat so that you can burn it for your energy. So that's another thing this medication does. So really excited to use that along with the weight loss injections. Also boost your mood and your energy levels like we talked about. So it is a low dose. You start really low for a week or two, let your body kind of get adjusted. You take it at bedtime, and then you can gradually increase it. You're going to be on a small dose even when you've increased to the max for weight loss. But it is something that you want to kind of gradually titrate up. There are some potential side effects, none that sound too crazy. Vivid dreams are common in the first few weeks. Sometimes it can cause fatigue because it can cause insomnia. Occasionally some flu-like symptoms, headaches or dizziness. I think a headache is a side effect of literally everything. And some mild anxiety. So if you have any questions, just post those below. I'm also going to put a link to my ebook. It's free, about reducing your insulin. I hope I hear feedback that it does explain how the insulin is so much a part of weight issues. And I think it's something that's just not given as much, not as much attention as it should. So I'll link that for you below. And again, if you have any questions, just let me know.